Okay, let's go ahead. We're going to get started here. This is our career chat for public health. Well, first of all, happy Valentine's Day. I hope that's a public service for anybody who forgot Valentine's Day. We are very fortunate to have two center alums of distinction in the field of public health joining us today. We have Dr. Daniel Summon, and he is an epidemiologist and researcher. And he's currently a research scientist at Essentia Institute of Rural Health. And then we also have Shelley Terrazas, and she is the Director of Operations and Administration at Emory University's Global Health Institute. What I'm going to have them do, each are going to talk a little bit about their career history, their career path, share some insights from their perspective about public health. And then we will open it up for questions and answers. Daniel is going to kick us off.
Okay. Well, thanks for coming, y'all. Thanks, Kirk, for inviting me.
Sure.
So, I'm an epidemiologist and a research scientist. I guess let me explain my how I got here. So, when I was at Center, I studied anthropology and philosophy, and I took lots of pre-health classes, but I wasn't entirely thrilled about going into medical school because my uncle had gone in and he became a cardiologist, and it was just seemed to me to be a relatively difficult life. So I never took my MCATs, and I just focused on trying to improve people's health in a population setting. So immediately following graduating, I actually did a summer research project. It was an archaeology and geology research project in Jordan. And we were out in the field, and we were camping for a couple weeks on end in the desert in Jordan. And I speak Arabic, so I had the opportunity to really interface with the local community there and get to hear what their problems and their health issues. And what struck me the most were the children, and just how bad their oral health was. And they didn't have access to a lot of great clean water, and it was a real far journey to get to a healthcare provider. So that just drove me that drove my interest in public health and epidemiology even more. I had applied to go to a master's program at the University of Kentucky, Master's of Public Health program in epidemiology, right before I went on this trip to Jordan. And I got in, and I wanted to focus on oral health and oral health epidemiology. And really, I wanted to do that internationally. So that was my focus when I was at the College of Public Health at the University of Kentucky. But as I was there, I learned that there's some serious oral health problems, and there's an oral health crisis in Appalachia, Kentucky. So much of my research as a master's student was focused on improving oral health among the poorest of our residents in Kentucky. So that's what I focused my first part of my research background on. After I finished my master's, I didn't know exactly where to take it. The job market in this field and in public health it's pretty tight, especially now. I've been looking around for other jobs. It's relatively difficult to move around, just so you all know that. That could always change. But after my master's, I did a fellowship at the College of Dentistry, where I continued to focus on oral health disparities across Kentucky. I became really well-versed in that topic, kind of an expert on oral health disparities across Kentucky. And after that one-year fellowship, I moved on to a doctoral level program at the University of Kentucky in epidemiology. And And the doctoral program really got me, got my epidemiology and biostatistics skills at a really high level. And just to fill you in on some of the research that I've been involved in or I've led, it's been very diverse. So if you're interested in applying skills to a very diverse set of problems, epidemiology is really where it's at. I have been involved in studying homicides and suicides in Kentucky. In addition, I've been involved in doing a hotspot analysis for agricultural tractor overturns. Now, this happens anytime a tractor kind of overturns and crushes the operator under it. And I've also been involved a lot in infectious diseases as well, from stool transplantation to, let's say, Ebola and Zika, as well as things like studying MRSA outbreaks in hospitals. So after my doctoral program, I immediately got a job in Duluth, Minnesota as a research scientist. And that's where I've been for about 5 years. And, the majority of my work is to write federal grants to get funding, to fund myself and my teams. And I have a couple of federal NIH grants, and that's kind of the majority of my work as a scientist. So that's where I am at the moment, and I can turn it over to Shelley if she'd like to talk about her career.
Sure. Hi, everyone. I'm Shelley Terrazas, and I'm currently the Director of Administration and Operations here at the Emory Global Health Institute. But when I think about my days at Center, and when I was trying to decide what I wanted to be when I grew up, I think for the longest time, wanted to be an ambassador. I knew I wanted to work globally, and I wanted to interact with different countries and cultures and just see the world. And so I was an international relations major at Center, minored in history, and I studied abroad in Strasbourg, in the Strasbourg program. I think it was a fairly new program when I was there, actually, too. But that experience of just living and working abroad really sort of solidified for me that that's what I wanted to do. And I wanted to represent my country and science and all of the things that make us good with other cultures. So after graduation, I moved to Atlanta, where I enrolled at the Georgia Institute of Technology in their master's program for international affairs. And that brought a little bit more of the science to the international relations major for me, looking at mapping and how to do the different economics of partnership building across the world. While I was at Georgia Tech, I also had to pay the bills. So I got a job on campus being a program manager for a chemistry professor. So this is a rather winding route to how I ended up where I am today, but this is what I would recommend for those of you who are trying to figure out what it is you want to do as a career, is to gather all the different sorts of skills that you can. And for what I do today, looking back, I can see that it was the business side and the program management side of skills that really helped me get to where I am. So as I said, I was a program manager for a chemistry department, but there were so many international scientists that came through the department. A lot of what I did was host these visitors, as well as deal with their budgets. So I learned a lot of on-the-job training of how to navigate the international system to bring people here and to travel overseas. So after I finished my master's at Georgia Tech, I really wanted to, again, focus more on the international side of things. So I moved to Emory University's law school, where I was, again, a program manager for a project that was looking at the intersection of Islam and human rights. And I began that job on September 10th, 2001. And we all know what happened the next day, and it's really been seared in part of my experience that I was lucky enough to work with a prominent professor in Islam on September 11th, and we were able to walk that journey together, really, of figuring out what that meant, how that then affected international relations and the different aspects of that. And the projects we were managing at this intersection of human rights and Islam really had a focus on women's issues, women and children. And that was my first foray into public health and how the different aspects of culture and theology and religion all fed into this field. So at the time, I continued to get experience in managing budgets and program management, but also at this law school position, I was hosting more and more visitors and navigating those systems to facilitate international research. After that, I moved to the Carter Center, which is based here in Atlanta. It's President Jimmy Carter's NGO that focuses on two things. They have a health section where they work to treat neglected tropical diseases, and they have a peace section, which is human rights watches, election monitoring, access to information, those sorts of things. And the reason why they have those two pillars is because they're so interconnected. Health really is, on a global scale, one of the best ways to be an ambassador for both your country and for the field. So at the Carter Center, I managed two projects. The first was in Ethiopia, where we were facilitating training of mid-level professionals, nurses and health techs, to standardize their curriculum and to increase the number of Ethiopian-trained nurses and health techs to go out into the community and to be community health workers. The other project at the Carter Center that I managed was a mental health project where we were using the same curriculum developed in Liberia, in West Africa, by consortia of nurses to train up mid-level workers with an extra mental health curriculum. As you know, as you may know, Liberia in 2008 came out of a vicious civil war, and about 70% of that population had PTSD. So there was a real need to treat this and all the accompanying other factors that go with a nation that has these mental health distresses. And mental health co-occurs with so many other issues, whether it's health issues, whether it's cancer or maternal or child issues, and especially child death. It's all interwoven. So those were two projects where we really were able to work with countries, with ministers of health, and with the presidents and the leaders of those countries to figure out the best way to solve local problems locally, but using best practices that other countries have learned. So that was really seminal. My third day on the job at the Carter Center, they put me on a plane to Ethiopia, and I spent the next month going to 12 different sites in the country, collecting primary data from really rural health posts, the kind where you have to travel by car and then walk several miles to get to these posts to see the encounter data for patients. And what we were trying to show is that better educated health workers will give community better outcomes. It sounds intuitive, but part of the process of bringing research into policy is to make that case and then show the leaders of a government or stakeholders or partners in country why this is good practice. So we were then able to take that data and make that case to the government, who then changed their policies, both in how they trained doctors, nurses, and health technicians, and the types of compensation that they made for these individuals. So I spent about 8 years at the Carter Center doing those two projects. And then I've moved here to the Emory Global Health Institute, which is really an advocacy and catalytic organization. And our purpose is to bring together researchers, funders, governmental partners, and all sorts of stakeholders multidisciplinarily to take research and move that into policy and implementation and action. And in my day-to-day job, it's also, I've moved back to the business side of things, creating contracts and hiring and retaining consultants and staff, and creating budgets and seeking funding that we could then give to researchers here on campus and in the greater Atlanta community. We work a lot with the CDC. Here in Atlanta, we also have a lot of other public health organizations, CARE, Emory University, Georgia Tech, Morehouse, Spelman, lots of really good academia organizations. And then Atlanta really has become arguably one of the capitals in the US for public health work. So to make these connections and to facilitate leveraging work of different people into something bigger is really fulfilling. And if you're interested in public health, I would definitely recommend looking at all the different multidisciplinary actions or routes that you can go beyond just the lab work.
Thank you both. Questions? We're going to open it up now. They give kind of a background, and this is a chance for you guys to do question and answer. Anybody want to be the brave first question? Or?
So if you're interested in public health, what would be some good internships to consider, especially either like summer internships or long-term for like a year?
I'm sorry, I'm having a really hard time hearing.
I'll say, she asked, are there any internships that you could recommend for public health? Good internships for summer.
From my perspective, the Carter Center has great internships. There are lots of smaller NGOs that are implementers that will either have a headquarters that you could get in on that side of things, or if you're working with an academic institution, like say here at Emory, graduate students especially have opportunities for field practice. And those could be supported with scholarships. Our institution gives some of those scholarships for field work. And that's under the guidance and mentorship of faculty members. So rather than an internship, it's actually a field study. The CDC has internships. NGOs and academic institutions, I think, would be a really good starting place.
Daniel, did you have anything to add to that?
I never did an internship, and I know of a lot of things available to master's students, but I'm not sure for right after your bachelor's degree.
I know.
And if they don't pay you, I would turn it away, really. At this point, internships really don't. There's some job sites that you guys should know about that aren't entirely that a lot of people don't know about. The Emory, keyword Emory Public Health Jobs, that's a fantastic job site. I'm sure Sherry knows about it. And APHA job site, that's a very good one too.
I would second that.
Yeah. And if you're interested in epidemiology, Epimonitor, EPIMONITOR. Those are really good sites.
So here's an alternative way of looking at things as well. Of course, this will depend on your personal financial situation and what you know you want to do with your life. But every time I'm interviewing individuals and am looking at resumes, 9 times out of 10, even for entry-level positions, but especially for entry-level positions, I will call back somebody who has gone through the Peace Corps. Now, obviously that's a volunteer and it's a situation and it's a 2-year commitment. But the type of on-the-ground public health work that you can get through the Peace Corps is amazing.
You know, if you guys, I work with a physician in Kentucky, and he is an infectious disease guy right now. He's a retired physician, and if you're interested in a brief research project, or you would like to get published, I mean, he would love to help, and he's very well known in Kentucky and across the nation. His name is Dr. Kevin Kavanaugh. You know, he's a very good friend. Just let him know Dr. Daniel Saman recommended him to you. Get in touch with him. We just released a big article about, you know, the number of estimated deaths that occur within hospitals, with what we call hospital-associated infections. If you have any interest in infectious diseases, this is the individual to go to in Kentucky.
Other questions? It's being so thorough. I've got a question, kind of similar to you guys talking about websites. Are there associations within your respective industries that are good to be part of? I know a lot of associations have student memberships, that sort of thing.
APHA is one. From
What does that stand for?
American Public Health Association.
Okay.
Also, from my perspective, the business and the program management perspective, and because I work at a university, NACUBO, it's more for staff, but it's one organization that has a lot of resources online, nacubo.org. Excellent reading on the sort of operational side of working internationally. There are a variety of protocol organizations that you can join, which is important if you're working internationally in global health, and public health is certainly in that purview. And then maybe Daniel can speak more about domestic organizations.
Yeah, just to talk a little bit about the American Public Health Association, APHA. It's mostly an advocacy organization. And public health, doing any type of public health work. So public health is the nexus of science and politics. You can't get away from the politics in this work. So just know that to be the case, because a lot of the work, I mean, just look at any public health crisis and think of the politics involved in it. Think about what occurred during the Ebola crisis. Think about what occurred during Zika. So if you have an interest in combining science and politics, this is the field for you. I would encourage you all, if you have an interest in public health, you know, it is a tough one to move from job to job. So once you have a job, I think it's relatively difficult. And I have a lot of family members who are practitioners, who are physicians and pharmacists, and also have MPH, Masters of Public Health degrees, and are very highly active in public health. So, always look at those joint degrees, like the MD, MPH, or the JD, MPH. All that stuff exists, or the DMD, MPH.
I would second that strongly, to bring in two separate disciplines and combine those, at least for employability later on, is always better.
Yeah.
Anybody have questions?
For people who come from a stronger science background, would you suggest them taking more business type classes in undergrad to help them if they're interested in going to public health?
Did y'all
Could
get
you
that?
repeat? Could somebody repeat that louder?
Yeah, she said for somebody who has more of a science background, would you recommend taking business courses in your undergraduate?
If you mean if you were to go on to public health?
Yes.
Yes.
Well, I didn't even know Center offered business classes. Oh, just economics.
They have an economics and finance now.
Okay.
They've added accounting classes. I mean,
Oh, I see.
you still have to be economics to stay within the liberal arts umbrella, but
Yeah.
it's expanded to where you can get some pretty substantial business courses.
I work very closely with economists. In fact, I have economists that are on my grants. Health economics is a beautiful field. To quote our president, it's a beautiful field. Beautiful. So if you're interested in economics, and you can combine health economics and have a really interesting career.
And I would say so too, because when you get grants to do your particular research as well, you will have a staff, but it's always good that you yourself could understand the business side of your grant. And that's key. And I think that's key if you're looking long-term as well, not just right out of school, but if eventually you want to either head an NGO or you want to have multiple grants, understanding that the finance side of things is important.
Would you mind elaborating a little bit more on how you work with health economists as a person who works in public health?
Yeah, of course. Well, we're doing. I lead two big studies, and one of them we're asking the question was this cost effective? So our health economists, he analyzes our cost effectiveness data, and that's why he's on our studies. In fact, you can look him up. His name is Dr. Steve Damer and Steve Ash, and they work at Health Partners in Minneapolis. He has a PhD in economics with a focus on health economics.
Shelley, did you want to chime in on that one?
I would reiterate that also that we work very much with global health and with other countries and the health information systems within countries. And it's always a question of, unfortunately, you have to pare down if you want to collect certain indicators, health indicators in the system. You have to make an economic case for why. and then the information that you glean from your research, you also then, like as mentioned before, the politics of it, so many times you have to make economic cases for why to implement certain policies. And the cost of non-health or the cost of sickness is another way to convince those making the decisions for particular countries or communities why they should pursue a particular route.
Thank you.
Other questions?
I have one. When entering the field of public health, would you recommend keeping a broad interest in a variety of different subjects or be more specified towards a specific path?
Oh, this is a good question. This is very important. and I, as an epidemiologist, you have to be able to do lots of different types of analyses. So, man, this is so hard to answer because right now, I mean, I would say specializing, really, and choosing, go look at the job sites that I recommended at APHA and the Emory job sites and have a look at what they're hiring for. A lot of it has to do with HIV and infectious diseases. Even though chronic diseases is really what is the big problem in the United States, I still think that a lot of money is devoted to HIV work and infectious disease work. And choosing your topic, whenever you all go on to get a master's or a doctoral degree or whatever you decide to do, I think focusing in on something that you like, but also something that you can transform into an interesting career, it's gonna be very important. And that changes, of course, but really over the last, 11 years, to me, I've really just seen HIV continues to be very important, especially globally.
I would say from my perspective, it's important to establish your expertise in a particular specialty, such as either infectious disease or even to go further and say typhoid or rotavirus or something within the field of infectious disease. Because then once you've established your expertise, you're able to then see how that translates. And you can see some really interesting connections between and among diseases and behavioral changes in health systems once you get a really good handle on something particular. For instance, you can start to see, and we have a project here where we're looking at typhoid, but also our new project on cancer, and in particular gallbladder cancer in some low and middle income countries, where you see there's a high co-occurrence. And so some of those questions are really interesting for the answers that they lead to. So I would definitely say specialize and then look for those opportunities to apply those skills elsewhere.
Another one that is really popular is pharmacoepidemiology, because we're focusing a lot on genetic-based treatments and finding more precision whenever we're treating cancers. So that's huge, actually. Anything related to pharmacoepidemiology is quite important at the moment, and will probably stay that way.
Thank you.
Any other questions? Don't be shy. This is your chance. Good questions so far. I have one more if nobody else has one. Are there any other specific trends in the industry to be aware of? I know you guys have touched on a couple of things like specializing and whatnot, and that it's hard to move around within a field, but any other trends that might be good to be aware of?
from my perspective, it's taking public health global and working in low and middle income countries. And to do that, your willingness to work in challenging environments. We also see a lot of need for language skills in our work, particularly French and Spanish, and increasingly Mandarin. So taking it global. But that being said, we have a lot of interesting things that local is global. And there are a lot of things you can do locally to add to the field of public health. So that I would say that's a trend of looking larger and then looking smaller into your own community.
Well, I agree with that, global health, because the world is becoming more and more flat. Actually, I would recommend that book, The Earth is Flat, I think by Milton Friedman. Any trends? I think precision-based medicine is a huge trend right now. I don't see that going away. Genomics research is very important. For the longest time, chemotherapies would just attack everything, and now that's not good enough anymore for treating cancers. So, yeah, I think pharmacoepidemiology, genomics, cancer research, infectious disease work, that's really quite popular right now. I think if you're going to get into research, you should definitely know that it is a very, it can be very tedious and very mundane. So know that, and you can work for a very long time without having, without seeing a massive impact. So if you are an individual that likes to actually see an impact of your work, take for example a dentist who fixes a kid's teeth or reduces someone's pain immediately after, I think you would be best served as a practitioner, either a physician or a dentist or a physician assistant or a nurse practitioner. So great careers, and I worked with some fantastic nurse practitioners as well. I mean, if you're someone that has an interest in writing and in research, I would recommend research, obviously. And what Shelley described, global public health is quite huge as well. Become fluent in Spanish if you can. That's definitely very important right now. And the CDC, the Centers for Disease Control, is where most epidemiologists are in this country. And they are, that's really important to them, that you can speak a foreign language.
And then there are increasingly moves for the most successful projects to bring in a cultural aspect, at least if you're collecting primary source data in hard to reach communities that may be experiencing, say, these neglected tropical diseases, or even in India now is seeing an increase in diabetes and other chronic non-communicable diseases. So being able to bring in the anthropological perspective, the religious perspective, all of these are important as increasingly low and middle income countries, as they become more comfortable with their own systems and with their own ways of governing. A big question in the field now is data and who owns it. And if you're collecting data in these countries, rightly so, the governments want to be at the table, and you have to negotiate what it is this data is going to be used for and how it will assist, and bringing your partners into the fold, so to speak. So I think gone are the days where say, American researchers can parachute into these countries and just extract the information they need. It's really a collaborative effort. So again, it's focusing on this politics and bringing in all these aspects to move the field forward, that it's increasingly multidisciplinary.
Yeah. And to add to that, in our fields, likely you have to be very nimble, and I remember my class at Center, we're relatively homogenous, and I can see that from this small group of students as well. You just get very comfortable working with lots of different types of people. I interview people. I recently hired a project manager, and the best people are the people that are very good working with others. That's so important to me. And if you can get an experience working with a different culture, a different community, that's gonna really set you apart. Anytime you go into an interview, try not to come into it with an ego. That's something that is a huge turnoff. And in public health, I mean, there are lots of sensitivities. The other guest was talking about, spending time overseas, and myself. And if you're dealing with Islam or you're dealing with another type of religion, you got to get comfortable that their traditions and practices and all that stuff is going to be very different than yours. And it could be shocking to you, in fact. But you have to stay nimble, and you got to realize that the world is a very big place. And, all of you, I assume, are interested in health. That's why you're here, or have an interest in improving people's lives. So you have to get comfortable working with people, and that's more easily said than done, because a lot of people are going to behave ways that are very different to yours.
That's good advice for any career, but maybe especially for going global. Any final thoughts that you guys would have for us? It's all good information.
Final thoughts that we have, or your students?
Well, either one. Final chance to ask a question, closing thoughts that you guys would have.
If I could just give a piece of advice, I would definitely recommend that you plan in your life path to pursue graduate education. That would be very important in this field, both for the specialty aspect and just for the breadth of knowledge that's out there.
Yeah, I second that. I think that's very important. I think there's one other thing, is that since you all are still in college, just do your best at getting the highest grades you possibly can. And that's going to come back to you. There's this myth that grades don't matter. That's just total BS. Grades are so important. They matter, and they'll come back to you forever, for 10 or 15 years. Like, oh, why did you get a C in this class? Well, that was 15 years ago. I have no idea. Try to do as well as you possibly can. And a lot of things follow whenever you really achieve.
Thank you both very much.